Grand Rising, beautiful people. So, today I decided to come and talk a little bit about my battle with depression, anxiety, PTSD from losing my vision. Sorry, my video is dark. There's no light around. I guess because it's a touchy subject and I'm feeling a little dark and blue today, so didn't feel like opening blinds, turning on light, or whatever. So to take it to the beginning, I've always dealt with mental health problems, but I never paid it any attention. It was kind of one of those things where I knew I was going through a lot of things internally, but I never told anyone, hey, I'm going through this. Hey, I'm feeling this way. My mental is not right. I kind of just was like, I'll pray it away. I'll listen to music. I'll do this. I'll do this. I'll do this. So I never focused too much on it. And then when everything started to happen with my vision, it's kind of like you have no other choice but to deal with it. I went through the 5 stages of grief. And I spent a lot of time in the depression part of the 5 stages of grief. I went through the denial, first realizing like something's really wrong with my vision. I used to drive when I knew I shouldn't be driving. I knew something was wrong. When I would leave work and I would literally have my eyeglasses on, I would put on a pair of shades over top of my eyeglasses, and then I would fold up a piece of paper and stick the piece of paper in the right lens of my eyeglasses to cover my right eye, just so I could see while I'm driving. And I'm like, this is dangerous. I know I shouldn't be driving this way. Or at night, it would be really hard for me to drive at night. It got to a point where I hated driving at night. I hated going places at night where I had to drive. And sometimes I would just be like, you know what? Hey, I'm just going to crash at a friend's house because I didn't want to have to drive home. But most nights I did drive home, and I would pray the whole way home. I would never take any back roads because I would have to turn on my high beams, and I can't see with the high beams on. So I was in deep denial. Finally came out of the denial and accepted the fact that, okay, my vision is messed up. My vision is like going. And I went into a depression. And with that depression, it's like I feel like I gave up on life at that time. Because at the time, I was going through the situation with my eyes. And not only was I going through the situation with my eyes, I was also going back and forth to the doctor like every other week or at least once a month for a while. And every time I'm going to the doctor, they're drawing blood and running tests. And eventually, when you're going through a lot and you're going back and forth to the doctor, and all they're doing is drawing more and more blood and running tests and all this stuff, you get tired of it. You don't want to do it anymore. And I just didn't want to keep going back and forth to the doctor. I hated going to the doctor. The nurses never listened to me when I would tell them when they were drawing blood, hey, you can't go in that spot to get blood. They never find a vein there. They always go in my hand, or they look up and find one in this part, like a certain part of my arm. But they wouldn't listen to me, and I would get poked 4 or 5 times before they can find a vein in the spot where I told them initially they should have tried. So I was just getting so like tired and fed up, and like I just was giving up on life. I was giving up on myself. All I wanted to do was just lay in the bed with my headphones in, listening to music and cry. I had actually given my mom, I was like, you know what? I feel like I should just give you power of attorney over me. I gave her my wallet and was like, here, you handle everything. Any type of business that had to be dealt with and handled, I turned all of that over to her. Like, I just didn't want to deal with anything. I didn't want to talk to anyone. Like, I shut the world out. I stopped talking to friends. I stopped talking to family. I didn't want to be bothered. It was like I was deep in it. And I remember one day I had an appointment to go to the hematologist, and they was trying to figure out why my iron was so low. Why is my iron so low? And so I had an appointment. I think the appointment was like at 9 that morning. So of course they wake me up. Hey, get up, take a shower, get dressed so we can get ready to go to this appointment. And I'm like, I wake up and I'm like, no, let's just call and reschedule it. I don't want to go today. And of course, my mom is like, no, you need to go. And I'm like, I don't want to go. And she's not understanding that the reason I didn't want to go was because I was just tired of feeling like like a needle pen thing, whatever you call those things where they stick needles in. All they do is poke me with needles to draw blood. And she didn't understand. And she's like, please don't do this. Please don't do this. And I'm like, you know what? Just have me committed. Just commit me, and then you won't have to worry about me. You won't have to deal with me. Because not only was it like I was feeling like that, I felt like I was a burden on my entire family. I had to depend on my entire family for everything. I had not so long had my surgery, and so with my surgery, I had to get eye drops in my eye a certain amount of times a day. I want to say it was like 3 times a day. Had to get eye drops put in my eye, and they would have to clean my eye because my eye was like draining. It was really goopy, so they would have to clean it. I had this like eye shield over my eye, so they would have to peel the tape off of my face, clean my eye, put these eye drops in, and then re-bandage my eye back up. So it's like I'm dealing with that, and I'm feeling like a burden because everyone's having to fix my food, bring me my food, help me put my shoes on, like basically help me with everything. I mean, I could bathe myself, I could dress myself, but I couldn't bend down to put shoes on. I couldn't see my feet, like I couldn't, normal things that you take for granted, I couldn't do at that time. So I'm feeling like a complete burden. So I'm just like, have me committed. And so she's like, fine. And so I still end up going to my hematologist appointment, where, what did they do? They drew more blood. So I leave the hematologist and I end up going to the emergency room. My brother takes me down to the emergency room because in my state, In order to be committed, they told my mom when she tried to call to get me committed, I had to go to the emergency room, and then that's how they'll do their process. So we go down to the emergency room, and what is the first thing they do? Draw more blood. And I'm like, this is the reason I didn't want to go to any place, because I don't want my blood work done. Like, it's not that I don't want my blood work done. I don't want you stabbing me with the needles. If there was a way that y'all could do blood work without actually having to prick someone with a needle, it would be so much easier. Especially a person who's getting poked every, like, once a month, it felt like. It was like so much, and I was so tired of it. So I go through that process, and I speak to the on-call psychiatrist, and the psychiatrist talks to me and asks me all the normal questions. Do you feel like harming yourself? No. Do you feel like you don't want to live? No. Well, what's going on? What's going on is I feel like I'm a burden. I'm going through all of this stuff, and no one's understanding what I'm going through. I'm very sad. I'm very upset. I'm tired of going to the doctor's office, and I'm tired of getting my blood drawn, being pricked every time I have to go to the doctor's office. I'm getting poked. I'm tired of that, and the nurses never listen to me when I tell them I'm a hard prick. You can't just poke me anywhere that you feel comfortable poking me. I have rolling veins. So she understood where I was coming from and was like, I don't think you need to be committed. I think you just need to talk to someone. Possibly you might need to be put on medicine. So she gave me a list of some therapists and psychiatrists in the area. Discharged me. I get home, like, okay, everything, go through the whole process of finding a psychiatrist. So I find a therapist in the area, because she said psychiatrists because psychiatrists are the ones who can prescribe medicine, and they can prescribe something and keep a watch on me, because they told her I had a couple of doctors who tried to put me on depression medicine when they first start seeing the signs of this depression with my vision stuff going on. And I told her I didn't feel comfortable taking the medicine. So she's like, a psychiatrist would be better suited for that, because they can keep an eye on you. They can keep a watch. They'll know which medicines to prescribe you. And I'm just like, no. So I found a regular therapist, and I started speaking to a therapist, and it helped a little, but it wasn't helping. Maybe because I didn't get to chance to talk to her long, because my insurance ended up changing. And when my insurance changed, I could no longer afford her. She was out of network. And so I had to stop going to her. So I stopped seeing someone. I had to do more testing. I had to get a colonoscopy, and the other one, which I can't remember what it's called, when they stick the little tube down your throat. I had to do that test. And so I had to do some more testing. I had to do a bone marrow. And so I'm doing all this stuff, and it's just like, okay, alright, when am I going to get a chance to start seeing someone? So finally, everything kind of cools down. I'm doing iron infusions. I finish up doing my iron infusions. I'm done doing like all these other testings and all this stuff. And I finally was like, okay, it's time for me to get serious and try to find someone to speak with. So I finally we called my insurance, found someone who's in network, who's not far from me. He was like an older man. He's like in his late 70s, early 80s. So I started going to see him. And I believe this was like at the end of 2018, so like October, November of 2018 when I started seeing him. And I saw him all the way up until lockdown hit in March of 2020. And so speaking with him was kind of helping, but I still wasn't where I needed to be mentally. And I'm still going through the 5 stages of grief. He pointed out to me, you're dealing with PTSD, which I pretty much knew I must be dealing. I'm dealing with a post-traumatic stress disorder. Like, something traumatic has happened to me, so I am dealing with that. But like I said, I'm still going through 5 stages of grief. I was at like that bargaining stage where I'm praying to God, like, please restore my vision. Please continue to bless me and my family. Please continue to bless me. Continue to make me healthy. Continue to make me heal. Continue to heal my eyes. Bring my vision back. I'm bargaining. And of course, there's nothing like, nothing happening. And I know that it doesn't work that way, but in that moment, like, and then you keep hearing people around you say, oh, just pray, just keep praying that he restores your vision. Just keep praying. And I'm like, you don't realize when you tell someone that and they're going through these stages, you can't tell them that because they're already in that bargaining stage. And in this bargaining stage, it's like when stuff isn't happening and it's like, why me, why are you doing this to me? And all I could think about was, wrong time to bring this song up and this person up, but all I could think about was R. Kelly's song You Saved Me. And in the song there's a part where he says people would say God's good and I would just laugh at them. And that's how I felt at one point in time. But then of course I my faith would never left me. It was just weakening, but I started regaining my faith. Like, my faith became stronger, and I realized, you know what? God is only putting me through a test because he knows that I'm strong enough to go through this test, to make it through this test, so that way I can end up with a testimony. So I ended up out of that. I went through the anger stage where I was angry with everyone. I was very passive aggressive with everyone. And so I went through that. And I finally I'm going through the acceptance stage. I'm finally at that point where I accept it. I do have my moments where I get sad and I feel down and I feel a little down and like a little sad and miss the fact that I don't have vision. And I start to wonder the what ifs. What if I still had my vision? What if, But other than that, I'm at that point where it's just like I'm learning to live with it. I'm coping with it. So, but like I said, with the therapist I spoke to him until pandemic hit, lockdown, in March of 2020. He stopped seeing patients because of his age, because he was an older man, and of course they're warning all the older people. So I stopped seeing him. So for a few months, I didn't speak with anyone. But then in June of 2020, I finally found another therapist and I started speaking with another therapist. And I'm still speaking to her till this day. She's been helping me a lot understand what I'm going through and listening and, guiding me through, giving me the encouragement to tackle some of my goals. She's helped me, she's helped me talk myself back into, it's not like she's telling me to do anything. It's, I tell her I want to get back out there talking to some people, but I don't know how I should do it. She gives me a little advice on how to do it. So I did start talking back to some people. I'm opening myself back up. I'm back on social media. I text with friends. If they call, I answer my phone. I'm just getting back to, I feel like I'm trying to get back to myself. I'm trying to get back to the person that I was before I lost my vision, but knowing I'm not the person I was before I lost my vision. So I at least want to get myself back, but that's gonna be a journey in itself, but I'm willing to make that journey happen. It's just, it's a one day at a time. Like, I literally have to take things one day at a time. Like, and actually, I really don't even take it one day at a time. I take it more 1 minute at a time. Like I said, some days, some moments, I can have that moment where I feel down and then I can snap right back out of it. So I found good coping ways for me is I've listened to a lot of podcasts. I listen to a lot of music where I don't listen to newer music. I stick with my old music. Like, I love music from the 90s and early 2000s. So I stay listening to stuff like that. And I relate songs to everything I'm going through. Like, I know random lyrics to songs because of the fact that I can relate that lyric to a feeling that I'm having. And so I cope with that. I listen to a lot of Audible books. I go through about anywhere between 4 to 5 Audible books in a week because I can just lose myself in Audible books. I get an Audible book and put it on, and I don't stop until I finish the book. And the books can be anywhere between 7 to 20 hours long. And I can stay up and listen to that book. So that's a great coping way for me. And with my deal, and it especially helps me with dealing with the anxiety parts of everything because I suffer with separation anxiety as well. I found that out recently. I've always known I've had like a problem where I always called it being homesick. I never wanted to be away from home for longer than like a day or two. I never wanted to be away from my mom for more than a day or two. I could never go without talking to her for more than a day. And so I'm like like describing some of the symptoms of that, like when I was deep in my depression and all I wanted to do was lay in the bed and cry. I didn't want to be alone, but I was alone. Like, I felt so alone. And if I was in the room alone, I would literally curl up in a ball next to my headboard where I'm laying horizontal in the bed with my back up against my headboard in fetal position, and I would literally cry with my thumb in my mouth like a baby, like cry. And I'm like explaining all of this, and my therapist is finally like, it sounds to me like you went through separation anxiety, and that came from an early childhood age. It came from the child, like my mother leaving my father when I was a toddler. Somehow or another, it stuck with me. I've been by my mom's side ever since. So I've grown attached to my mom. It's not one of those unhealthy attachments, but I'm definitely attached to my mom. And so I'm dealing with the separation anxiety. I deal with the social anxiety of going places, feeling alone, like in a room full of people, feeling alone. So I deal with that. So I do take anxiety medicine when I need to take it, but most of the time I try to find coping ways. I've started meditating to try to handle the anxiety. That's helped a lot with that's helped me a lot, unless I let the anxiety go so bad, cuz sometimes I will feel the anxiety coming on, but I won't do anything to stop it. I won't I won't take precaution, like, okay, I feel like an anxiety attack coming on, let me calm myself down, let me distract myself, let me either let if I know I can't do that, let me go ahead and take an anxiety pill to try to calm it down. But I won't do it. I just let it like get to that point where it's like, okay, now I definitely need to take something. And by the time I take it, I'm in like full anxiety attack mode. And with my anxiety attack, because I'm diabetic, it feels like my sugar is dropping. So it's like I sometimes it's like I never know if it's like my sugar dropping or if it's anxiety attack. But I most of the time I do know it's an anxiety attack. And so it's like I'll ask, hey, can you check my sugar? Can you check my blood pressure? Just to make sure my numbers are right and my numbers will be okay. And I'm like, oh, that's definitely an anxiety attack. And so I'll take an anxiety pill and try to calm myself, listen to relaxation music, listen to sounds of the ocean, something just to calm my mind. And then eventually I'll doze off, and when I wake up, I'll be fine. So it's been, a rough journey. Making it through. So, like I said, it's one of those things that I take minute by minute. So, thank you for listening to me. Remember, like, comment, and subscribe. And as always, you are beautiful. Toodles.